driving decision, it is, a tough one. In the literature, the ability to drive has been called for people as they get older, and really for any of us, the asphalt identikit. The literature talks about that driving is probably the single most important marker of self-esteem for individuals as they age. Nobody wants to be the bad guy in this scenario. Family certainly doesn't want to be the one. Adult children do not want to be the ones to say, Dad or Mom can't drive any longer. Friends are in a tough situation. Neighbors often worry, but they don't know what to do. And physicians often struggle with, as Dr. Kettle might in his office say, I don't really know whether this particular individual is safe to drive or not. I can take the history, I can do some tests in the office, but the real assessment needs to be a thorough assessment that in our program includes a road test. So you'll be hearing about that. The program goal is to provide objective assessment of driving safety while we really support the patient and the family in that process. You can't jeopardize the capacity to drive without really plugging in the emotional support as well. We use a multidisciplinary team. Our program has become a national model. We've been featured on television. We have videos. We're involved in research. And we think that it really represents the gold standard of assessment programs. We integrate research and public education like we're doing today with our clinical practice. So who are our clients? We've seen over 600 individuals in the 15 years since the program started. We see individuals with underlying medical, cognitive, or psychiatric problems that may interfere with driving safety. We have a range of diagnoses from Alzheimer's disease and other dementias, multiple sclerosis, Parkinson's disease, ALS, stroke, patients who've had ECT, patients with bipolar disease, orthopedic problems, brain tumors, and some patients who are brought to us simply because their children worry about frailty and older age. We've had individuals as young as 17 and as old as 97, and our 97-year-old passed our assessment. So what are the important lessons that we've learned in 15 years? Age alone does not predict driving safety. That needs to be a take-home message. If you don't remember anything else I said, two things. Age alone doesn't predict driving safety. Ann and I are working on a project where we're compiling data from our oldest old drivers who've come through our program, those who are 90 years and above. We have a pretty robust pool of 27 patients, with one more this week that's coming in, so we'll have 28. And guess how they've done? Have they passed or not? Most of them have passed. A large majority of them have passed. We are thrilled and delighted. We have some hypotheses about what to explain this with, and we can talk at the question and answer about this. But we will be looking more closely to understand what sorts out the oldest of old driver who's safe to drive versus those who aren't. And the diagnosis alone does not predict driving safety.
What people experience when they come to us, the type of tests we do to establish whether someone is safe or not. It's an evidence-based assessment. No, I'm going backwards. I have no technical skill, as you can tell. And clinical social work, Lissa, they're the bookends. They're at the beginning and they're at the end of the program. They can be the bread, I'll be the filling in the sandwich. And we have a mental status screening as part of it, occupational therapy in-office testing, a road test, which we do with a driving instructor. And then about 2 weeks later, the person comes back for feedback. So at that point, they get some recommendations from us of how they've done.